Hello. Before I introduce myself, I wanted to start by taking a look at this illustration from World War I. As we can see, it's a comic meant to belittle the then so-called conscientious objectors. These were men who refused military service based on certain moral or religious beliefs. These objectors would help spur the introduction of certain conscience clauses. These have since expanded into many other areas of society, such as education with the Right to Pray Amendment, and also healthcare. So that's where I like to focus our time today in terms of healthcare provider conscience clauses. My name is Dustin Gill, and as a bit of a disclaimer, I am a pharmacist, so I do have some experience with this topic. However, the point of the presentation is not to sway one way or the other for or against conscience clauses. It's really just to provide, as we'll see, some of the key issues that healthcare providers and others face in terms of these conscience clauses, provide a brief history of these conscience clauses and some of the applicable legislation that's out there, and as well, lastly, to identify some of the ethical considerations that need to be taken into account surrounding the topic. So we'll start out by looking at some of the common dilemmas. And as you see, I have bolded the top three, and they are providing abortion services and prescribing and dispensing of birth control or emergency contraception, otherwise known as Plan B. So this is where a majority of the legislation and the majority of the discussion on this topic lie. There's obviously certain other dilemmas that healthcare providers may face in terms of their moral beliefs. I've listed a few here: treating gay patients with HIV or AIDS, sale of syringes to IV drug abusers, performing in vitro fertilization to lesbian or single women, and then preparation of lethal injection cocktails. So certainly there's other dilemmas, but what we'll focus on here today is where the legislation focuses on at this time are abortion services and contraception. So this makes sense when we look at the history of conscience clauses. So Roe v. Wade, obviously everyone knows that's the 1973 Supreme Court decision that legalized abortion. So as a result of this decision, this sparked the introduction of conscience clauses for healthcare providers by both federal and state governments. Now I included this New York Times headline because I thought it was kind of interesting. The ruling wasn't even the main headline of the day, as LBJ died that day, so it's kind of a secondary headline. But as we know, this topic remains a heated debate to this day, and it remains unresolved. But let's look at the initial response to this Roe v. Wade decision in terms of conscience clauses. So pretty much immediately when this was passed, we get the church amendments sponsored by Senator Frank Church, which allowed healthcare providers and individual entities that received federal funding. They were able to refuse abortion and sterilization procedures based on their beliefs without any type of backlash or discrimination. And then soon after, most of the states, so 47 of the states plus the District of Columbia, passed similar legislation allowing healthcare providers to refuse to provide abortion services. So in addition to the church amendments, there's some other federal legislation that involves these conscience clauses. The first, as you can see, Title VII of the Civil Rights Act. This was enacted prior to the 1973 Roe v. Wade decision. However, it does relate to conscience clauses in the fact that it mandates that employers cannot discriminate against employees based on their religious beliefs. And then within the past 20 years or so is really when we see a lot of the legislation related to conscience clauses being passed. And a lot of that is a result of the use of birth control and emergency contraception becoming more available. So we have the Public Health Service Act of '96, the Weldon Amendment, and of course Obamacare with the Patient Protection and Affordable Care Act. So these are specific acts that provide some protection for healthcare providers and allowing them some conscious refusal to provide certain services. and we'll get to this a little later in the next couple of slides. The Weldon Amendment initially was very broad. However, it was a lot of the provisions were rescinded by the Obama administration. The Affordable Care Act does provide some protection for healthcare providers in terms of refusal. However, it does also have certain mandates. For example, that health insurers cover preventative care, which they included as birth control. So obviously that is going to cause some debate as well, and we'll get to that a little later as well. And one of the more significant cases that involves conscience clauses. And there's also a number of bills out there that have yet to be passed that are still in Congress. One of the major ones that deal with conscience clauses is the Healthcare Conscience Rights Act, H.R. 940, which serves to essentially broaden the protection of healthcare providers and giving them the ability to refuse certain services based on their beliefs. Next, we'll look at some state legislation. So the states are very diverse in some of their legislation, so we'll just kind of look at them as a whole. As far as abortion, 45 states specifically allow providers some degree of refusal. In terms of contraception, so birth control and emergency contraception, 12 states allow some degree of refusal in providing these services. In addition, 6 states have laws that specifically allow pharmacists to refuse to provide medications for religious or moral services. Now, on the flip side, there's a minority of states that also mandate that providers provide some of these services. So it's really a gray area with the state legislation. It varies state to state, and there's no real consensus at this point between the states. So obviously, as you can imagine, there is a lot of political debate with this topic. I mentioned earlier the Weldon Amendment. This was part of the Omnibus Appropriations Bill by the Bush administration. Originally, it was very broad, and it allowed for a lot more protection for healthcare providers and the ability to refuse certain services. However, when the Bush administration came in 2011, they rescinded many of these elements, so it narrowed the scope of the Weldon Amendment significantly. Again, as I mentioned with H.R. 940, a lot of these anti-choice lawmakers, they continue to push for expanded refusal clauses, and on the flip side, those who are against these conscience clauses, they are, they're proponents of narrowing the refusal clauses as much as possible, as they feel it is the duty of healthcare providers essentially to provide equal services to all patients. And as we just mentioned, a lot of the states, they remain inconsistent with the regulations, and it varies really from state to state. So there's no real consensus there. When we look at some of the major cases that have come up recently, the major one that really made national headlines for a while was the Hobby Lobby case. This was the case where Hobby Lobby challenged the mandate of the Affordable Care Act that it was required to provide coverage of birth control for its employees. The ultimate decision was that they were exempted. Now, there were certain reasons they were exempted. For example, they were considered a closely held organization. But regardless, it was a win for proponents of conscience clauses. On the flip side, there was a recent case in Washington State where a pharmacist was challenged, where a pharmacist refused to provide or to dispense emergency contraception to a patient. Went to court. The ruling was by the Washington State Supreme Court that pharmacists are required not only to stock emergency contraception, such as Plan B, but also they could not refuse to dispense based on religious or moral beliefs. Obviously sparking a lot of debate, and this was just passed recently at the end of 2000, or this ruling was towards the end of 2015, and proponents of the conscience clauses are, really supporting this go to be heard by the U.S. Supreme Court. So potentially not the end of that, not the final say on that case per se. There's also been, there's a bunch of rulings when it comes to this, but of recent, there was also a California court that ruled Catholic hospital may refuse reproductive health care for certain patients. And this is significant in the fact that in today's healthcare system, there are a bunch of mergers. Essentially, health systems are buying out these individual entities. And one of the compromises is because many in this country, a lot of the institutions are religiously oriented. The compromise is that they keep their Catholic identity, and with that comes along oftentimes they want to refuse certain abortion services and reproductive health care. So there's, like I said, there's a lot of cases, but these are some of the more significant ones, especially with Hobby Lobby. We'll probably see more of these come along in the coming years, but it remains a hot debate. Lastly, we're going to look at some of the ethical considerations. So we looked at the history of these, kind of some of the major issues, and we're focusing on really abortion and the contraception. But what are the pros and cons? So we're looking at provider rights. The proponents of conscious refusal clauses argue that it's really unethical to force someone to provide care that goes against their beliefs. On the flip side, those who are opposed to these refusal clauses feel that it is the duty of the healthcare professional to provide care regardless of their beliefs. They argue that they, one, discriminate against patients, but also goes against informed consent in the fact that oftentimes if providers will refuse care, they will also if they refuse to provide care, they'll also refuse to give all necessary information that patients will need to know all their potential options. So that's kind of the argument, the main argument for or against these conscience clauses. You then have to kind of look at, well, what are the consequences? For example, if healthcare providers, if they're forced to comply, well, you obviously will have some anxiety or shame if they're going to have to go against their religious or moral beliefs and are forced to do so. Some may even change profession. And then what are the penalties for refusal? So those are all, that's kind of a question that's to be determined. As far as patients, if they're refused treatment, what are the potential health risks? Are they being denied medically necessary information? And then also they could feel discriminated against. So it's obviously, these are the things that you need to take into account when dealing with these issues. So ultimately, where do we stand? These conscience clauses, specifically in relation to abortion and contraception, they continue and likely will continue to be an ethical dilemma for lawmakers, healthcare providers, and politicians. The legislation still varies and is dynamic and is constantly changing, especially over the past 10 years or so. Ultimately, the issue of moral beliefs versus societal interest, again, it remains unresolved. Public opinion in saying that varies as well. So when, as a healthcare provider or as a patient, these are the things that you need to think about in terms of this issue. It's yet to be resolved, and likely won't be resolved in the near future. But and personally, these are the things you need to look at and take into account when looking at this topic. With that, I'll leave you with my references, and I thank you for your time.